Bilateral Knee Replacement, Your Best Recovery. If you are considering going for two, this is the Facebook chat group for you. We have an incredibly active membership made up of many wonderful people who have already gone through a bilateral knee replacement. They have a lot to say about it. Of course, it's free to join. Search Facebook groups for Bilateral Knee Replacement, Your Best Recovery. You are most welcome to join the conversation and make the most of your bilateral knee replacement surgery.
Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
Hello and welcome to the Bee's Knees podcast. This is your host, PJ Ewing. We have two things for you today on the broadcast. First, we have some research, a look at what happens if you have a partial knee replacement, what's called a unicompartmental surgery, and you then say, oh, wow, I'm going to have to follow up after a few years with a total knee replacement where they do all aspects of the knee with the hardware. Is that a good idea? Is that a bad idea? Does that have additional risks? This study goes into some really important detail. It's also recently published in 2019, so we've got new evidence that supports conclusions that you might want to hear about. So I'll go into that first, and then right afterwards, we'll go into my interview with Donna Gross from North Carolina. Donna did two knees at once, bilateral knee replacement, but she wasn't originally going to do that. She made a decision along the way to go for two, and she talks a good deal about that and why she did that and what were the implications in terms of, okay, hey doc, I want to do two, not one. What happens next? So it's a good interview, and you'll hear a lot about how a person who does two knees at once does in recovery as well. But first, let's get into the research. This is our research review. And the study that we're going to take a look at today was published in 2019 in the Journal of Bone and Joint Surgery, a very respected source. The article is entitled Revision Risk for Total Knee Arthroplasty, Converted from Medial Unicompartmental Knee Arthroplasty. It's a mouthful, of course, but what it really means is you did a partial and then you did a total. What happened? Is that a good idea? Are there risks? And let's talk about that. I will have links to the article in the show notes and on the webpage for this podcast, so you can go and read it yourself. The title of the article in News Medical Life Sciences, Study Compares Unicompartmental Knee Arthroplasty and Total Knee Arthroplasty. And it was reviewed by Kate Anderton, BSc. She's the editor. It was published on November 25th, 2019. Unicompartmental or partial knee arthroplasty, UKA, is an alternative to total knee arthroplasty for some patients with knee osteoarthritis. When UKA fails, conversion to TKA has been thought to be a reliable solution. However, TKA converted from UKA had inferior outcomes compared with TKA performed as the primary procedure, reports a study in the November 20th, 2019 issue of the Journal of Bone and Joint Surgery. That's the original source here. The journal is published in the Lippincott portfolio in partnership with Walters Kluwer. The risk of revision surgery is 3 times higher for TKA converted from UKA compared with primary TKA, according to the new research by Anders L. Galali, MD, and colleagues of Aalborg University Hospital in Denmark. Higher revision rates after UKA is converted to TKA. That's the heading of this section, and this is where we're getting into the meat of the matter. In UKA, partial, just one of 3 compartments of the knee is replaced with a prosthesis. Because UKA is a less extensive procedure that preserves most of the normal knee anatomy, it offers faster recovery than more common TKA. An advantage of UKA is that it can be readily converted to TKA if needed. So it's really nimble, it's really flexible. It's a great decision if you have part of the knee that's causing a problem, but the rest of the knee is in good shape. With the use of Danish National Registry data from 1997 to 2017, the researchers compared the outcomes of 1,012 TKAs converted from UKA, 73,819 primary TKAs, and 2,572 revision TKAs. The study focused on implant survival rate, implant failure requiring removal and replacement across groups. Patients who underwent TKA converted from UKA were younger, the average was 66 years old, compared with those who underwent primary or revision TKA, those are average of 70 years old, and also had less severe knee joint degeneration, according to Charnley class. That's from Sir John Charnley, a measurement system. For patients who underwent conversion of UKA to TKA, long-term outcomes were similar to those who underwent revision TKA. Both of these groups had an estimated 15-year implant survival rate of 78%. In contrast, the 15-year implant survival rate for primary TKA, so you just did a total knee replacement, that's it, was 94%. After adjustment for other factors, the risk of revision was 3 times higher for patients who underwent UKA to TKA conversion compared with primary TKA. I know there's a lot of initials going on here, but I think you get it, right? It's that it's better to do a total knee replacement in terms of survival rate of the prosthesis versus doing a partial and then converting it to a total. So it's better to go for the full knee replacement in terms of survival rate of the prosthesis than to go with first a UKA, then a TKA. Some more notes here. Implant type did not affect outcomes for patients who underwent conversion of UKA to TKA. As in previous studies, the main reasons for UKA conversion were implant loosening, unexplained pain, and the progression of arthritis. Partial knee replacement is an increasingly popular option for patients with knee osteoarthritis who have limited knee joint damage. Although UKA doesn't last as long as TKA, the ability to convert to TKA, if needed, has been thought to offset that disadvantage, and it is sometimes assumed that the outcomes of UKA to TKA conversion are similar to those of primary TKA. Clearly, that is not true. This new study questions that assumption, suggesting that the risk of revision following conversion of UKA to TKA is similar to that of TKA revisions, indicating a similar surgical complexity. Dr. El Galali and colleagues note that their analysis of Danish registry data supports the results of similar studies from Norway and Sweden. And these are the words of the author with their conclusion, in quotes, "On the basis of this study, we believe that careful consideration is necessary before using medial UKA as treatment for knee osteoarthritis, as a potential conversion to TKA decreased implant survival compared with that following primary TKA." And so that's our little research review for this week. I think there's one little lesson, which is, hey, if your doctor is saying go do a partial, you can always convert to a total. There's real research with lots of people involved that suggests that that conversion has a much higher rate of revision opportunity, meaning having to do it all over again, than if you had just gone ahead and done a total knee replacement. It's just one of many studies. Don't base a lot of decisions on just this one study, I would say, but it's something to bring up with your surgeon. And if your surgeon says, well, yes, I've read that study, and I guess you may be onto something there, and you are a candidate for a total knee replacement, if you'd like to skip the partial and go to the total, there may be logic there that suggests that you should go ahead and do the full Nelson versus do the partial. And that's our research review for the week. Thanks for listening to this. Let's get into the interview with Donna Gross.
Hi, this is PJ. I am here with Donna, and we're going to talk about, surprise, knees. It's the Bee's Knees podcast, right, Donna?
Right.
I don't think anyone's surprised at that, right? They're ready for us, our devoted listeners. Donna is in North Carolina and has gone through 2 bilateral knee replacement, and it's recent. And so we're going to understand what that was all about with you, and how you evolved and grew and changed your opinions and got approvals and did all kinds of things to go with 2, how that happened. And then I want to hear a little bit about why you needed the surgeries and then how it's been. So the whole Nelson, the whole smorgasbord of questions, I guess. But before we do that, Donna, let's go learn about you. Tell us about you and your background and stuff.
Okay. Of course, my name is Donna. I live in Winston-Salem, North Carolina. I am 65 years old, mother of 2. I have a son and a daughter, and grandmother of 4. Have 3 granddaughters and 1 grandson, ranging from ages 9 down to 3. They are the joys of my life. I am a born-again Christian. Praise the Lord for watching over me, taking care of me during this process. He's been so good to me. That's probably my number 1 praise, and I think that's why I've been able to do as well as I have. I'm exactly 4 weeks out from bilateral surgery. I had it 4 weeks ago today. I was in the hospital for 4 days and came straight home. Doing wonderfully well. I have been able to rest and relax, do some things that I've been wanting to do. I've done a lot of reading in the last 4 weeks, a lot of studying and things like that sometimes I don't have time for. This has kind of slowed me down somewhat, given me a little bit of personal time to do some things that I wanted to do. I'm very thankful for that. So
Wow.
even though it has been quite a journey so far, it's not been completely pain-free, but it's not been an unhappy or a bad journey, that's for sure. And I'm super glad that I'm 4 weeks on this side of the journey instead of 4 weeks on the other side.
So 4 weeks before surgery, how would you describe yourself? You just painted a picture of a lady having time to herself, reading, contemplating, a break. It sounds like a vacation. Now, I know it wasn't. Of course it wasn't a vacation, but it sounds very peaceful. 4 weeks before surgery, what was life like then?
Oh, life was very painful. I had 2 really bad knees, bone on bone, both of them. One was a little worse than the other. I had meniscus tears in both knees, arthritis, of course, in both knees. Every step I took was a jolt of pain. I had been enduring it for probably 2 years. Of course, it gradually got worse and worse. I have done everything possible that I could have done leading up to the surgery. I've had physical therapy. I did cortisone shots. I actually did 2 different sessions of the gel shots, the gel injections. Everything that I could to prevent having surgery until it just got so bad. The doctor said, you just have no other choice. You're either going to have to live with this pain or you're going to have surgery and have it replaced. At the time, I was only going to do my left knee, which was a little bit worse, and have gone into all the preparations, just deciding to do one knee, and then at the very last minute, decided to do both at the same time and get it over with.
And what tell us more about that. What made how did you make that decision? That's kind of a big move to go for 2 at once.
It is. I had done a lot of research. I've done a lot of reading about the surgery, about what was going to happen, about the recovery, about the physical therapy. I've read and researched, just done a lot of things. I'm not the type of person that likes to go into something without my eyes being wide open. So, I know what to expect. I knew that there were things that I needed to plan for. There were things that I needed to do ahead of time. Actually, this is kind of funny. You, PJ, were the first one that mentioned to me that maybe I should look at bilateral surgery instead of just doing one. You in a conversation that you and I were having one time, you said, well, have you ever thought about doing both knees at one time? And it kind of opened my eyes a little bit because I never had even thought about it. And I said, no, not really. But after we hung up and I talked to my husband about it, and I thought, what do you think about this? Realizing, of course, that it would make a difference. I would need more help. I wouldn't have a good leg to stand on, so to speak.
Yeah.
And did a little bit more research then on the bilateral process. Fortunately, I had the perfect situation as far as coming home after the hospital. My mom lived with us for 10 years before she passed away earlier this year, and in our home, my husband had made her an apartment downstairs on the ground level of our home. So everything was already set up anyway. I mean, I have a handicapped bathroom and a bedroom and a little kitchenette, all on the ground floor. We have
Perfect.
2 sets of steps, upstairs where we lived. But I knew that would work anyway. After doing more research and talking to my family, because I realized, like I say, I would be totally dependent for a little while on someone. I talked to all of my children and my husband. And then when I went to the doctor for my pre-op visit, I told the PA that I was speaking with, I want to do both legs. And he quite frankly said, no, we won't do that. And I said, well, I want to do both legs. I want to get it over with. I want to just go through this process one time. And he said, well, your surgeon will not do that. He doesn't do both legs at the same time. And so I just said, well, it's what I want. If I have to change surgeons, if I have to change practices, I want to do both legs at one time. I want to get it over with and do what I need to do and be well and not have to repeat the process in 6 months or a year. And so there at the very last minute, I'm talking the week before my surgery was scheduled, I switched surgeons. And it did happen to be within the same practice, and just decided to go on and do both knees and, like I say, get it over with. People told me I was crazy, but I knew it's what I wanted to do. I had prayed about it. I had peace about it, and looking back now, would not change it for anything. I know it was the right decision.
I didn't realize the drama, Donna, behind the scenes. Talk about faith in God and fire and brimstone and a lady with a resolute opinion. There you were.
There
nope,
I was.
I'm going to do too. You won't do it. Nope, I'm going to do Well,
yeah.
All right.
I'll find somebody that will. Yeah, that's what I told
It's
you.
a big world. It's a big world, and I'll do what I want. That's very bold, Donna. You're so mild-mannered. I didn't know you had such steel. You should have known better.
It shows up when I need it.
Yeah, I guess so. And, you had the backing of your family, obviously, and you did the homework and you prayed on this. Wow. Now, wait a minute. I do recall the conversation we had way back when. Did you end up poking around that bilateral group on Facebook? Was that of any value?
Oh, yes.
Or? Okay.
Yes, definitely. When when we spoke that day, you said to me, now don't take my word for it. Let me get you hooked up with this bilateral knee group, and you did that same day, and I have, oh my goodness, I've read everything on there since then. In fact, when you called me a while ago, that's what I was doing.
Oh, is that right?
Checking up on them. Mm-hmm.
It's quite a community, isn't it?
It is.
Pretty cool.
It is, and it's been so very helpful. So very helpful. And I hope that the comments that I've made on there, since my surgery, I hope that I've been able to help, somebody else.
It's not quite bringing. Go ahead. I'm sorry. There I go, stepping on your words. I told you I would do that, Donna.
No. You're fine. I do that too, so you don't worry. I know when people go on their pre-surgery, they're nervous and they're afraid and they don't know what to expect. And it's just so very helpful to have somebody say, okay, I'm a week out or 2 weeks out or, 6 months out or whatever, and this has been my journey. And it's just been so very helpful to have had somebody literally walk in my shoes. So
I don't quite have tears. I don't quite have tears in my eyes, but I will tell you that my heart truly leaps when I hear what those groups are bringing people, because I have some others for different conditions. But that one, the bilateral group in particular, is such a community. It's not big. It's very tight-knit for such a disparate group of people all over the planet. And, your journey, I mean, we talked about 8 weeks. It's even longer than that. But the journey from where you were to where you are, I mean, there's a life-changing event in the middle of that. And you're able to express and share and learn, throughout that time frame. It's kind of amazing to have a group like that.
It is. It absolutely is. And the fact that people that are on there have gone through what you're getting ready to go through, I think is so, I don't know, it can give you the peace that you need, or maybe the calmness that you need, to know that, hey, look, they've gone through this, they're doing well, they got past this, or this helped them, this didn't help them, maybe I should look into this, maybe I should do that. It was just so very helpful. And it still is helpful. Like I say, I was just on it a while ago. I check it, 4 or 5 times a day. So.
Well, they run their course, right? There's a moment where, and you're the kind of person, it sounds to me like you're going to want to be involved for a little while longer at least in helping the people following, and then you move into other phases of life, and it's not your big thing, right? But for however length of time you're participating in that group, this sort of itinerant, transient little place, I know that there'll be great value for others. Some stick around for years, just trying to be helpful. And they get to know people and become friends. And I know people, there are mentorships, and some people actually get on the phone with each other, and it's really a collaboration, and that's just taking it to the next level, which is beautiful.
Right.
I wish all the groups were quite as active as that one. That one is my star group, that bilateral group.
Well, I can see why.
Yeah. I didn't expect it either.
It's a great group.
I started all these groups with the intention of just providing a forum, because I struggle with the fact that the people are not as educated as you by any stretch. They're blind walking into this surgery. They may have attended one class at the hospital, and that's kind of it. They're there, bone on bone, knee pain, let's get it done. That's the extent of their education. So, and some of them, thankfully not you, some of them pay for it. It just isn't going well, and they're in trouble and this kind of thing. So you're not in that category. All right, so what was your recovery? Tell us about post-surgery, the first 2, 3 weeks, 4 weeks. I mean, it's been 4 weeks since the surgery. What was that like? Let's talk about the pain, the challenges, how that went.
Well, my recovery has been really good. I'll just start that way. Of course, not pain-free, but pain manageable. I was in the hospital for 4 days, in a wonderful hospital, by the way, Clemens Hospital here in Winston-Salem, through Novant. And I felt like I was in a 4-star motel. They took such great care of me. I mean, it was it was marvelous. Kept my pain under control, kept me comfortable. Of course, I had, the 2 Iceman machines constantly going. The nurses and the doctors there were phenomenal. The physical therapists there, I felt like the Queen of England or something. They took that good. I'm not kidding. It was a marvelous experience. Well, when the PA told me at my pre-op visit that my original surgeon, would not do 2 knees, he said, let me speak to one of the other doctors here in the practice. We really normally don't do 2 knees at one time, but let me speak with him. So he did. He went and spoke with Calvin Maxwell McCabe. And Dr. McCabe looked at my history, and fortunately, praise the Lord, I am, other than having arthritic knees, very healthy. I am not diabetic. I don't have problems with my blood pressure, my sugar. I don't have anything else wrong with me other than, my knees. So Dr. McCabe took a look at everything and said, yes, I'll do both knees for her. I actually only met him the Friday before he did my surgery on Monday. So I was really pleased with everything.
That's a pretty important meeting, right? That was, it could have gone the wrong way. If you didn't like him, I'm supposing it could have been a bad, problem, but it went well enough. He's a good enough bedside manner, that kind of thing.
Oh, yes. Oh, heavens, yes. He was wonderfully kind and explained everything to me and explained why he chose to do both knees when it's something that they normally don't do within their practice. And, kind of jokingly, when I said, well, I'll see you 7 o'clock Monday morning, he said, well, no, you probably won't see me, but he said, the only reason that I'm going to do your surgery is because you are as healthy as you are, and, looking at your knees, both of them need to be done. So, yeah, super, super nice. I felt quite confident with him. One of the maybe more humorous things is that my sister-in-law actually works for that practice. She was on vacation, and I called her and said, are you sitting down? And she said, oh, my goodness, yes. And I said, I just talked to Dr. McCabe, and we're going to do both of my knees Monday morning. And she's like, what? Have you lost your mind? But, yeah, and so, yeah, the whole practice. Let me tell you, when I left the office that day after speaking with the PA, before talking to Dr. McCabe, by the time I got home, which was a 20-minute drive maybe, they had already switched my surgery date to 2 weeks later so that it could be on Dr. McCabe's schedule, already switched all my physical therapy, already switched all of my other appointments. They took care of everything for me before I could even get home.
Wow.
I'm telling you, they were phenomenal and have been ever since. Wow. I can't say enough about the care I've gotten from them. They're concerned. They're so nice. His PA, oh my goodness, phenomenal. Her name was Laura.
Laura.
And of course, I met her. She came to the hospital several times. I've already seen her, since I got home. The care that I have gotten from them, I can't say enough about it. I have absolutely no complaints, none whatsoever. I couldn't have asked for anything any better.
Wow. And when Dr. McCabe went in, because you're the one, not the practice or anybody else, saying do 2 at once, what did they find in the other knee? It was supposed to be just one. What was the consensus, I guess, after the fact?
Well, he did my left knee first, which was supposedly my bad knee. Mm-hmm. And then he told my husband after the surgery was over, he said, when I went into her right knee, he said, I am so glad she decided to do this because her right knee was just as bad as her left, if not worse. So, therefore, had I not done both knees, then he said she would have, worn that other knee out, possibly affecting her hip, her ankles, possibly could have done a lot of damage. And, then we're talking about other surgeries down the road. So
this is the moment, Donna. This is the moment, Donna, where light bulbs should be going off in those who are listening to this right now, because this is you making a decision, having done lots of exploration to figure out that you're going to go for 2, and it turned out that this was such a wise decision, and medically they did not know what they found out after the fact.
Right. He said, looking at the x-rays, my right knee did not look as bad as my left knee did. He said, but when I got into her knee, it was as bad, if not worse, than the other. So, praise the Lord. Wow. I made the right decision.
Yeah. Guidance. You got there. That's, wow. That's really interesting. So 4 days, that's a long time in the hospital in this VIP, beautiful, lovely facility.
Mm-hmm.
And
had a little bit, just a little bit of a problem, which was, was the extra day. My iron level dropped, probably due to blood loss during the surgery. So Dr. McCabe just decided to keep me an extra day and give me, some iron through my IVs. So that was the extra day. I was really just supposed to be there 3 days, but he decided to keep me there just that extra day and give me some additional iron before I came home.
What insurance do you have?
I have Medicare.
Medicare. So what's interesting to me is that they sometimes want to hustle everybody out of there. I mean, you've heard, same-day surgeries, et cetera, but there was no race to get you out of there. It was all fine.
No, sir. Dr. McCabe took care of all of that for me. I haven't dealt with my insurance not one time.
Wow.
His office has taken care of, I haven't signed a paper, I haven't done anything. His office has taken care of everything for me.
Amazing.
Mm-hmm. It is.
Okay, so you get home, and then tell us about your recovery. What happens next?
Well, like I say, I came home to the perfect setting, and I came home on a Thursday with all kinds of medicine. He put me, of course, I had pain medicine. I had an iron supplement. I had a nerve medicine. So he kept me quite comfortable. Now, like I say, it wasn't pain-free. I don't want to give anybody false hope that you can do something like this and not have any pain, but it was quite manageable. I came home on Thursday, and then on Friday morning, David delivered my wonderful X10 machine and set it up for me, educated myself and my husband on how to use it and what to do. I got on the machine immediately that day, started using it, used it 2-3 times a day for that first, few days there. Really, really, really helped with my flexion and my extension, and it was completely pain-free. In fact, it felt really good to be able to move my legs like that. I had a friend that stayed with me to give my husband, some relief from the 24/7 care that I needed. So she stayed the first couple of nights here with us. And my wonderful church family has been delivering food, meals to us every other day ever since I've been home. So that's another blessing. Like I say, my children are local. So between my X10 machine and the physical therapist, Dr. McCabe had physical therapy come here to me for the first 2 weeks, and then I started going outside for physical therapy. So I've done my X10 machine, my physical therapy, the exercises that they have given me. You sent me a lot of information about exercises to do. I've, tried to keep up with doing all that. And I think that's one of the reasons why I've done so well is movement is so very important after you get home. You have a tendency to want to sit or stay in the bed, but you've got to get up and move your legs. And I have done that. So when I go to physical therapy now, the therapists are like, oh, my goodness, you are our star patient, because my flexion is at, 120 degrees and my extension is at 0. And, I'm walking with a cane now instead of a walker. And they're like, you are just our star patient. We wish everybody could be like you. Everybody could do as well as you are doing. So I feel successful.
Well, yeah. Well, you are successful. 4 weeks, the traditional recovery for 4 weeks, right, having looked at all the literature and the data, is that someone has lost half their strength. Their range of motion is, I guess, approaching 90 degrees, and they are, in the thick of it. They're in the thick of it. They've moved from home care to outpatient care, and now they're going to the clinic, and the clinic is where it all is really going to happen. And they've got 4 to 6 weeks before to get it right is pretty much the normal situation.
Right.
But you are with bilateral, it's even the slower recovery. So you're 120 and 0 and on a cane, and in a peaceful state is really, it's a great place to be, and you deserve it with all the homework that you did and all the effort after all this.
I give the praise to the Lord, that's for sure.
Yeah. And David is also very devout. I know David and Tricia, and you worked with Tricia pretty frequently, yes. I guess, didn't you?
Yes, I did. She is such a joy. Oh my goodness, we had the best conversations. We did. You? She would call to check on me, and find out how I was doing. She would look at my results, on the machine and things like that. And then, we would end up staying on the phone for an hour, just talking to each other. Yeah, I feel like I've got a new friend. She and David are all their jewels. Oh,
aren't they? Oh,
yes,
they're so great.
Absolutely.
They're so great. Well, I know.
Yeah.
Wow. I want to know. Is there anything else about the recovery we should talk about? Because I wanted to move on to what are you reading in this peaceful 4 weeks of recovery? Where has that led you? This time to yourself. I'm curious about that.
I've been I've been able to spend a lot of time in my Bible, uninterrupted. Even though I am retired, I do work a little bit. I have a friend that has a tax business, so I help her out. And like I say, I have 4 grandchildren that live in close proximity to us. So I've stayed busy with babysitting, picking the kids up, going to ball games, going to ball practices, taking them here, taking them there.
Already?
Giving mom and dad relief. Oh, no, not yet. But, that's what I was doing before.
Right. Okay.
So very, very involved in my church, doing different activities. And I work with our children at church. I work in a hospice ministry where we deliver food to hospice, and just really involved and on the go all the time. My husband used to say to me, Donna, you are going to have to slow down. But I have slowed down. This 4 weeks has been slow, so it has allowed me to my children gave me Amazon gift cards for Mother's Day so that I could load books onto my Kindle. So like I say, I've been able to do a lot of reading. I've been able to get into my Bible and do some Bible studies that I was really interested in that I hadn't had time to do before. I'm not much of a TV watcher, but my children put a 50-inch TV down here in my bedroom, and of course there's a TV in my living room, and brought me movies to watch and things like that. It's been like I say, and then with the food being delivered, and fortunately my husband's here. And I realize a lot of people don't have 24/7 care like I have for the last 4 weeks. He's been here constantly, and if he's not here, he makes sure that somebody else is, one of my children or one of my friends or things like that. So the recovery has been smooth. It doesn't seem
and you're
like
still
it's
not
painful.
quite done, right? I mean, we're on a cane. I mean, let's not paint a picture that it's you're off to the ball games quite yet. Yeah.
I'm not doing steps yet. I haven't gone upstairs yet. They're not allowing me to do steps.
Okay.
And like I say, I do walk without my cane as long as I have something to hold on to, or as long as I'm close to something. I'm being very careful. The last thing I want to do is fall and do any damage. But I am practicing walking on my own. So I do have a way to go. I mean, when I go to physical therapy now, we're working on my walking, on my gait, and things like that. So
are you doing strengthening work as well?
Do lots of strengthening work.
Yeah.
At physical therapy and at home. They've given me exercise. I have a band now and several exercises that I do before I get up. I do exercises in the bed, then I get up and I do exercises in the chair. And then, of course, I walk and do, other things that the physical therapist wants me to do. So,
good.
Yeah, it keeps me busy.
Well, keep an eye on that email series, too, by the way. That goes on for a few more months that we send out, because there are activities, of course, to do, but there's also a lot of other consultation, let's call it, on scar management, and we even have some recipes and some dietary things, although hasn't been a problem for you, but it goes on and tries to move beyond the acute phase of recovery, which you've moved well past. And, but it's 2 knees and it's 4 weeks. So I would say Donna is back, really back, between weeks 8 and 12. Let's call it, where you're like, oh, okay, no walker, no cane. I'm driving. I'm doing those things that you described earlier. You're actually, back into. So I'll give yourself another, Halloween is going to be fun, and then, Thanksgiving, and, you're off to back to yourself by Christmas, I'm sure.
Right. Christmas is my goal. I realize, it is a slow process. I do kind of push myself sometimes, and I have a couple of times overdone it and have paid for it, and just had to back off for a day or two. But, reality is that this is not a quick process. It is going to take time. And, and actually I'm thinking that, this time next year, when I look back and I'm completely recovered and completely myself again, I'm going to look back on it as a year-long experience that's, been a good one and the right decision.
Right. And when we did discuss this in July, August, and I said, just for sake of it, everybody in the Bilateral group on Facebook, 100% of them say they would do 2 again, and
oh yes,
I think that you'd be on that list. It sounds like.
Oh, amen. There's no way that I would ever not do. I mean, this was one of the best decisions I've ever made.
Wow.
Ever. Wow. As much information as I had, and as much as I knew going into it, and as much as, like I say, as I researched it and everything, had I decided to do one knee, I think going back and doing the other knee would have been difficult, because I would have known then everything that I was going to have to go through, everything that my family was going to have to go through. This has not been just Donna's journey. This has been my family's journey. and it's it's taken time and effort and on their part and willingness to come and help me. So I'm glad that I don't have to put them through that again. So we're past that.
Yeah. I don't think about that enough myself. I think about recovery and mechanics of recovery and the X10 program, and I think about you having to have the X10 there twice, which is twice the expense, and that's why my head is all there. When I'm talking to you in July, August, I should have been thinking, I should have thought that about these other factors, because they are just as important. You put the community through this twice or once. And, I've heard from a lot of people say, I can't face it. I'm putting that next one off as long as I can, because I just can't face the whole rigmarole again, in 3 months or 6 months or a year. And they then put off the other knee. And now they're not really there. They're one good knee, one bad knee. They're in between. And you just, you mentioned a year from now, sure, absolutely, you'll have almost forgotten that you had them done, because you're pain-free, walking around, all doing your life,
Yes. Yeah. That's what I'm looking forward to, instead of having to go through this again.
Yeah.
And like I say, not so much for me, but like you say, I only had to go to the hospital one time. I only had to go to physical therapy one time. I only had to rent the machine one time. I only had to have my friends and my family help me one time. So it's definitely been the right choice.
We're going to look up
and wanted to do.
Yeah, well, we're going to look up in Wikipedia, bilateral knee replacement, and there's a picture of you. Here I am. Any questions?
Here I am. Yes. Let me help you. Let me help you decide. It is the right thing to do. Now, I do understand. I had almost the perfect, the perfect, I don't even know what to call it. My health is good. I realize that, my health is good. I had the right place to come home to. I did have the right help. I had the right circumstances. I found you. I found the X10. That's, it was perfect storm, if you want to call it that. And I realize everybody they don't have those blessings. They don't have those opportunities. But if there's any way they could work it out at all to do bilateral, it's just the best way to do it. I mean, there is pain involved, definitely, but there's pain involved regardless of whether you have one or two. So that was another thing. I'm a big baby when it comes to pain. I don't handle pain very well. So I thought, well, if I'm going to have to be in pain anyway from having one knee done, why not just get the pain over? What's the difference? Let's just get this over. Let's just do it one time and then not have to worry about pain again.
I think for the person listening,
that was another reason.
To this, right? They just heard, another lightning bolt, another light bulb, whatever. You sound like the resolute, onward Christian soldiers. Damn the torpedoes. Yes. Yet you just said you don't like pain, and that's really interesting, because that's a physiological thing, the reaction to pain and tolerance. And I would have thought that she can take it. It doesn't sound like it. It sounds like
no. I'm a big baby when it comes to pain. Yeah, my husband can testify to that. But I knew that there was going to be pain. It's not, but like I say, let's go on and get them both done and get it over with, so you don't have to go through the pain twice. So.
Well, I think we did it, Donna. This has been really great. Is there anything we missed? Anything that you've been amazing? Anything else that you've wanted to say, or?
I can't think of anything. Like I say, I think we pretty much covered everything that I can think of.
Great.
I haven't had
Well,
any problems. No,
yeah.
no
No,
allergies, nothing.
Yeah, I
Everything's
know.
worked
It's
out
been
just
it's
fine.
been a dream kind of recovery. It's
Yeah,
really amazing.
absolutely.
Well, thanks so much for doing this. This has been really fun.
You're welcome.
You just helped a whole bunch of people. Seriously.
Good.
So
That's my goal. That's what I
yeah,
want to do.
you did. You did. You should feel good. You did your good works for the day already
Good.
in this morning. And thanks for participating in this. I know that it's kind of weird to get on the phone and do a podcast interview, but
No.
I'm glad you did.
No, it's not weird to me at all. I was in the training department in a financial institution for 15 years. I did a lot of podcasts. I did a lot of online training. I did a lot of stuff over the phone. This is fine. This is normal for me. I'm used to it.
Awesome.
So
you're good at it.
Mm-hmm.
Well, thanks, Donna.
You're welcome. Thank you. Thank you for all your help. Oh, my goodness, your information and the things that you send me and the things that are online, the things that are available out there. You don't realize how much you help people, I'm sure. You've helped me tremendously, not only in the equipment and everything, but just the information and just how much you put out there. Oh, my goodness. Sometimes it was even hard to keep up with it. I'm like, oh, my goodness, here's another one that I need to open and read.
Darn it. PJ, cut it out.
No, please don't cut it out. Please don't cut it out. It was great information, and it was tremendously helpful. So
that's great.
I appreciate that more than you'll know.
We'd like to thank a few friends of the Bee's Knees podcast, including the Knee Pain Guru, natural solutions for chronic knee pain without drugs, shots, surgery, or painful physical therapy. For more info, visit thekneepainguru.com. We're also brought to you by X10 Therapy. And special thanks to Dr. Justin Trosclair at the podcast A Doctor's Perspective Podcast.
I'm Dr. Justin Trosclair, host of 2-time Podcast Awards nominated A Doctor's Perspective Podcast. I interview doctors in and out of my profession about their specialties and the occasional non-doctor special guests. But we also go behind the curtain and see what's working for their marketing, overcoming struggles, practical knowledge, book choices, and relationship advice. Join me on any podcast app on your phone or visit adoctorsperspective.net for the show notes pages and free resources. I want you to have an abundant home life as well as a thriving practice. So come on, take a listen.
Natural Knee Pain Rescue. Save your original knee with a habit-based diet and lifestyle. This is a transformational program that helps people lose weight, reduce knee pain, get healthier, improve mobility, and avoid knee replacement surgery. You can learn more at naturalkneerescue.com.
The Bee's Knees podcast comes to you from our studio in Lower Manhattan, New York City. We're here week in and week out shedding light on all aspects of knee surgery and recovery. To reach us, send an email to thebeeskneespodcast@gmail.com.